Hello, my name is Kay Aubrey Shemaine, and I'm the director of Photonic Therapy Institute. I'm your host for this Independence from Pain Summit. My guest this session is Scott Kennedy of Light Path to Wellness Clinic in Fort Lee, New Jersey. Scott is a certified light and laser specialist and a health coach with a bachelor's and master's in science. Last year, he started the first light therapy wellness center in all of New Jersey, where he helps clients from all walks of life, all ages, and with the gambit of issues: marathon runners with shin splints, bodybuilders with chronic shoulder pain, weekend warriors with back tightness, and those suffering from autoimmune diseases, neuropathies, concussions, skin issues, anxiety, and even depression. Scott began his wellness journey 6 years ago when he suffered from peripheral neuropathy. He saw countless doctors and tried remedies with only limited relief. He went from running ultra marathons and boxing to being completely sedentary. He couldn't even wear socks and shoes without burning pain and inflammation. If you're a person that uses physical activity to alleviate stress like Scott does, you know that the inability to be as active as he wanted to be contributed to increased stress, anxiety, and depression. Scott was more than skeptical when he began using light therapy. The change took time, but was incredible. Within 4 months of treatment, his symptoms decreased over 80%. The improvements he gained from light therapy were life-altering. He's now back to running and boxing and living life to its fullest. Scott's goal now is to help others get back to doing what they enjoy in life without pain and without meds. Welcome, Scott.
Thanks, Kay. Good to see you.
It's good to see you too. Scott and I have worked together a little bit. He came out to one of our photopuncture classes and added that to his already deep toolkit. Scott, tell us a little bit about your journey, about how you found the light therapy that turned things around and what that took.
Well, it was, just going all the way back to, when I was 18, I joined the military, Air Force, and I was a dental technician. Following that, when I got out, I went to school, got my bachelor's in science, focused on dental hygiene. After about 6 or 7 years, I was having some physical issues, wrist, neck, typical issues from being hunched over all day. So I got into doing some teaching, and I also got into doing dental sales. So the company that I was with for the last 6 years was a laser company. So with dental, we were doing hard tissue, so cutting enamel with a laser, cutting soft tissue, doing perio, doing snoring, all kinds of different treatments. So it was very eye-opening to me to see a whole new world of potential for dentistry to be done minimally invasive, quicker, more efficiently. Now, one of the other things that it could do, if I put the laser right up to my tooth or my cheek, it would cut it. It would ablate it. No different than a scalpel. But if I pulled it away and I allowed that the energy to dissipate over a greater area, we just turned that into photobiomodulation. So as I was working with those handful of dentists that really grabbed onto light energy and really understood what it was doing, what I found is they were treating not just their patients with TMJ issues or treating for Bell's palsy, treating for post-extraction or anything traumatic in the mouth, treating the lymph nodes to speed up the healing process, but they were using it on themselves and their family. So tennis elbow, their son who sprained an ankle, their father who had shingles, family member that had a herpetic lesion. So I started to just learn a little bit more about all the possible uses of this. And then I started to use it myself, just with a small unit that I, bought off eBay. And I started to see more of the effects on me and my family as well. And that's when I decided, okay, this is so interesting. It's so fascinating. So I said, let's jump into this a little bit more. And then, there's no school for photobiomodulation. So there's no like 2-year, hey, I'm going to go and I'm going to do this and I'm going to be next. So you got to seek out and find
Right.
research. You got to find people like Kay, like you, who's taught me so much. You got to find your mentors, you know, people that have been doing this for a long time, that really know the ins and outs. And it's really about just delving in and learning all the nuances with this, because there's so much. That's one thing. It's endless learning.
That's for sure.
Yeah, and I haven't been in it nearly as long as UK, and I don't know a 20th of what you know. So I got to a point where I was like, okay, it's time for me to, you know, extrapolate my knowledge and put it to use for other people. And that's where the light path to wellness came about. And that's kind of where I am right here.
How did you shift from laser to panels, or add panels? I shouldn't say shift away, but add panels and other tools to your practice.
Yeah, well, you know, there's a difference between, there's a lot of differences between lasers and LEDs or panels. You know, yes, they have the same wavelengths, but the biggest difference is going to be really, you know, cost. Cost is a big issue.
Sure.
So lasers, a lot of the initial studies were done on lasers. So that's what we initially went by. And then they found that they were having great success with LEDs, which are safer. They're less expensive dramatically. There's no way I could have a panel you see on the walls behind me, or have a immersion bed with laser. It would just be ridiculously expensive. And again, you deal with safety issues. So I do combine some things with laser super pulsed, and then I use more for spot treatment. But then I also bring in LED. So whether it's the photo puncture torches that I use on just about every patient for the health and balance or sympathetic, for the immersion bed, or for the panels, are all going to be LED.
Mm-hmm. And when you're using, so you have all of those in your office now. How many clients can you be working with simultaneously? Like one in a bed, one in front of panels? How do you do that?
Yeah, really just, you know, at best 2. You know, if I have a family of 3, then we can work it out. So initially when the client comes in, first thing I do is the photo puncture torches. And the reason is what I found out, you know, before I went to your course in January, I was realizing that the clients that were coming in, yes, they had a shoulder pain, they had a hip pain, they had something going on. But as I talked to them, I started to realize, well, there's more to this than just the physical pain right here. And what I realized is these people they're stressed out.
Right.
You know, they've got anxiety, they've got depression issues, they've got all sorts of other things that are going on. And as we all know, when you're stressed, when you've got anxiety, you build up inflammation. So yes, there could be a physical issue here, but I also realized that if I just focused on this here, I was only getting to half of the problem. So that's a big reason why, Kay, I took your course, is because I started noticing there's got to be a better way to do this, a better way to give an overall treatment for the patient so they can be more relaxed. And what we know is if we can get them into a relaxed state, then the rest of their body starts to work better. So when the client comes in, that's the first thing I do. Then depending on you know, their condition, if it's you know, a knee or back, I'll go ahead and do spot deep penetration for that. If it's somebody that's dealing with neuropathy or some kind of a autoimmune or Lyme, then, you know, subclavian lymphatic system as well. And then they'll go onto the vibration plate, which just helps get the circulation going, helps get the lymphatics going. And then they'll go and do the immersion bed for, you know, about 10 minutes typically. And that's that's generally what the session is. So it entails probably about 40 minutes to an hour worth of time.
That's a nice progression, though. I like that.
Mhm.
Open the emotional, get the emotional balance, go directly to the problem, then and open the lymph. That's great. That sounds like a really effective approach. So tell us a little bit about some of the people that you see and their stories.
I would say now I've been fortunate to connect with a few trainers in the area. And, these are the kind of trainers that think outside of just, put heavy weights on and go. They're very holistic in their thoughts. So they were very open to coming in and trying this out. And it's interesting with these trainers, big, tough guys. And, what they got the most out of is they're like, you know what, I just feel a sense of calm and peace. And for them, there's nothing better than that. We can go after their aches and pains, but they really want is just a way to de-stress,
Right.
a way to feel at peace for the next couple of days. And so they saw really good results, whether it was aches and pains or just their stress level going down. So they, of course, are bringing this up to their clients and having their clients come in because, of course, if their clients are in pain, they're going to cancel on them. They're not going to be able to push themselves as hard. So the majority of my clients are those probably in their 40s, 50s, 60s. They may have been more athletic in the past and they're just trying to keep going, or maybe they're trying to get back into shape, or maybe they're like, hey, you know what? I'm tired of being, sitting on the couch all day. I need to get out. I need to start working out. I need to live life better. But they're hampered by something, some pain in their body that really limits how intense or how frequently they can work out.
Sure.
That's the bulk of my clients. Now, I've had other clients that have come in for post-concussion issues. They were going through a lot of mental issues that are very common with post-concussion. Anger issues, anxiety, just extreme stress. So one was a firefighter that I've been able to treat, and he notices, about 3 days worth after getting treatment that he's just so much calmer. And so we're just slowly progressing to get him better, but those take time. I've got a client with Lyme disease, and she's seeing improvement, but she's been getting into boxing, and she was only able to do one time a month because it would just exhaust her afterward. It would take her a full week just to recover. So we started to treat, and she started to do 2 a month, 3 a month, 4 a month. And within just a couple months of time, she was up to 3 workouts with the boxing trainer per week, which is just a huge difference for her.
Yeah, that's
now,
amazing.
Unfortunately, with the COVID and me having to close down, we went 2 months without being able to see her. And she started to notice the symptoms starting to come back. So she's just recently gotten back in here, which is good now that we're back to open again. So we don't have to start the process over again, but we just have to kind of get the maintenance going back again. And we have to understand that certain diseases like Lyme, chronic Epstein-Barr virus, things like that, these are things that, we can't fix with 1, 2, 3 appointments. It takes time.
Right.
And it takes maintenance as well. It takes a lot of preventative work also. One good client, she owns the yoga studio right next door. No real aches and pains, but she wanted to try out the bed. And this is what's fascinating with light therapy is when you learn things that I didn't even know. She never mentioned any issues with that she had, but after about the fourth appointment in the immersion bed, she came to me. She said, well, I had an outdoor event, hot sunny day, and normally I can hang out in the sun for about 15 minutes And then I start to get a rash and get real itchy. She's got a sun allergy. But she said, I went out there and after 15 minutes, I didn't seem to have any issues. So I was like, well, I'll hang out a little bit more, a little bit, about 15 minutes longer. She ended up being out in the sun for 6 hours.
No.
No rash, no itching, a slight sunburn that ended up turning into a tan, which was the first time she's had a tan in 20 years. And she came to me with this and I said, I have no idea. I did not know that. So I just had to do some simple research to find that, yeah, light therapy helps to release certain cytokines and enzymes in the cells that make them more resistant to the harmful effects of the sun.
Sure.
So that's what can be really fascinating about this is some of these things you may be treating somebody for something else and then they come to you and say, by the way, and you go, cool, interesting.
Yeah, we just keep adding layers to what we know.
Right.
Yeah. Dr. Hamlin at the World Light Therapy Conference in 2018, his term was the abscopal effects.
Right, I love that word.
And everybody in the room, this is the first session, and there's all these researchers from around the world, and everybody was Googling what abscopal meant on their phones within 10 seconds, and it just meant out of scope, that we're getting all of these benefits. We don't know why. We're not sure why this one works yet, and so then some research team will go figure it out. But why are we getting all these benefits? And so that just made so much sense to me because I started 25 years ago when we had no idea why it worked. We just knew it worked. We were doing woo-woo witchcraft and this was all holistic nonsense. And over time, of course, it's now become so researched and so known in the scientific communities, but they don't always tell people outside of the university tower what's going on. And so it filters down gradually as we find out that, oh, it improves reactions to the skin. Oh, it improves liver function. Oh, it might improve this or, neuropathies. We've known about neuropathies for quite a while, but all of the side benefits to that. So yeah, I love that. I wouldn't have put together that she would not be photosensitive either. So that's impressive.
Yeah. And we've had some really nice success. Behind me, I've got the couple panels, and those are almost identical to what I've got in the full bed. But obviously, they're smaller, more meant for home use. So, for those people that aren't in the vicinity that can't come to see me, that's a great option. Or for those people that logistically, maybe work-wise, they can only come in every couple weeks. Well, then they can have a panel to bring at home to keep that process going. So, I'm not treating them once every month and not being able to see the results.
Now, are your panels just red? Are they red and infrared? Are they polychromatic? What are you using? So
I've got a combo. So I started off with the typical, and this is, all the other panels out there are basically the red near infrared, 660, 850 wavelength. The more I researched, the more I realized not one wavelength cuts it. Sometimes not even just the two wavelengths can cut it. So I added blue in because I know how beneficial it is for acne issues. And my daughter has acne, so she got it from me. So I felt bad. So I said, let's try this one. And she's had great success with it. So it's a red and blue panel. I recently got into green. Green is actually really good for skin hyperpigmentation, but they're also doing some new research and showing positive effects for migraine and depression type issues.
Yeah, I've heard nervous pain that green is really getting a lot of looking for nervous system pain and helping because it's a cool color like the blue. It's more cool than the red.
Right.
Yeah.
Absolutely. And so then now I've added, I've got a couple new ones coming out that are completely different from anything else. So I've got one with 5 wavelengths. So it's going to be 2 in the red, 2 in the 800, and then a 910.
Wow.
I've also got them coming out that are going to be pulsed. Now, Dr. Hamlin can, of course, talk more about that, but we've really seen the benefits. We can't exactly say why, but we see benefits with when we can add frequency and pulse the light. So we've seen that for the brain, 40 hertz pulsing has been beneficial. So I've added that, and also the Noia frequencies, who is a French neurologist who came out with the 7 frequencies. And what he found is that unhealthy cells, first thing, everything in life vibrates. We know that. Okay, so everything in our body vibrates. Unhealthy cells vibrate at a lower rate than they should. And he realized that. So he said, okay, well, if we can introduce the correct vibration, the theory is that we can get better healing. And sure enough, that's what we've got. So there's 7 specific wavelengths, between 73 and 4,900 that he used for more specific type issues. So so what I'm going to do is I'm taking what started off as kind of a beginner panel. Panels are great for beginners. Red, near infrared, continuous wave. It's pretty simple. And now I'm taking it more towards the experienced person, the person that already has that panel, but they're ready for that next level, and they're ready to delve more into what different wavelengths can do for them and what different pulse durations, frequencies can do for specific body parts that are going to be a step above just the typical continuous wavelengths that we've got on the market now.
Oh, you know me, I'm all about the Noia frequencies. I've been using them now for 25 years, and I'm so tickled to finally see a panel. I never really wanted a panel till I heard about yours that was going to have the pulsing in it. And I'm still looking forward to that showing up as soon as they hit the market.
It's on its way. It is on its way. And so I'm going to have different levels structured. So, kind of like a level 1 is the basic. Level 2 will have the different colors. And level 3 will have not just the 5 wavelengths, but also will have the pulsing together. So it'll certainly be something that nobody else has there. And it's going to be reasonably affordable. And that's the one good thing with panels. We can talk about the importance of torches to light up certain specific parts, which is huge. We can talk about pad systems, being able to put that right on the skin, which is great, being able to cover a whole area. Panels are a great way for somebody to start the process of getting introduced to light therapy.
Right. I'm looking forward. I use light all the time, but I'm looking forward to having one in my bathroom. As I'm getting ready in the morning, I can just put that few minutes to use and just add that nutrient of light to my life.
Right.
And without having to go and plug in my pad system or do whatever targeted therapy I'm going to do. I love the idea of the general therapy, especially pulse. So, right. Yeah.
I mean, and I would love to work more with people that teach meditation, yoga. What a great way first thing in the morning to take that 10 minutes to just sit and relax, work on your breathing exercises, and have the panel in front of you. I mean, it's just maybe your coffee as well. That's a good way to start the day. So that's what I'd really like to get into. Beyond, of course, people with aches and pains, it's just, we live in such a stressful life. And with everything going on, gosh, we just need a breather. And, there's no silver bullet. You don't put the light and all things heal. We have to be very holistic. We have to understand, okay, I'm not the expert in nutrition, but I know somebody who is.
Right.
I'm not the expert in this, but I know somebody who is. We've got to bring everything together.
We need sleep. Everybody needs some sleep, which luckily the light helps with that.
Absolutely. It's like a plant. I say, when people ask about it, I said, well, the best analogy is photosynthesis with the plant. So now the plant needs sunlight, but it needs water. It needs healthy soil. We can bring the light. So what we can do is we can you know, take a plant, we can bring it inside, we can put specific bulbs above it, and it can grow as long as we still add the water and the soil. So I use it as an analogy to tell people, you can't come in here and just be, okay, I just got to do this. No, if your nutrition is horrible, I'm sorry. If you're a smoker, you know, there's certain things that, you know, even this can't penetrate.
Right.
No pun on that one, but so the idea of being able to have that morning on a and taking that 10 minutes just to be able to relax and get into your groove with the light panel or pad or your photo point, I think that it can be so beneficial to the rest of your day.
Now, do you also suggest that your clients hydrate more, like especially if they come in and have a light session?
Yeah, so I recommend half their body weight in ounces. So simply, if they're 100 pounds, they should be drinking 50 ounces of water per day.
And if so, yeah, we're the same. We're in Arizona, so we're kind of, instead of half, we do, if you weigh 200 pounds, you need 200 ounces a day.
Yeah.
But not that very many people get there, but here this time of year in Arizona, you need it.
Right.
But I know that much like going to a massage therapist, I bring this out for people who go and get themselves a panel or go and get a light therapy tool. They start doing a bunch of light, but they don't increase their water intake.
Mm-hmm.
You could get some serious headaches, some serious detox reactions. You got to help keep the body hydrated. And, you know, we really wanted to give some good pointers like that to people watching. Maybe they've never seen anything about light therapy before.
Mm-hmm.
What else do you talk about with absolutely new clients who've never heard of light therapy, or this is their first foray, as it were?
Yeah, you know, the toughest thing is really just, it's a matter of educating them. You know, if they come in to see me, they are coming in typically because they already either one of the few that know about light therapy, or they talked to somebody that had success, one of their trainers or a friend or coworker. So when they first come in, it's a matter of giving them enough education, not to overwhelm them, but so they understand what we're actually doing. Meaning, okay, there's this light. Well, that's kind of weird. I just shine this light and I start to see these up, or all these crazy benefits. And we say, no, it's cellular. It's 1-2 jobs that it's doing that create this cascade effect throughout the body. So I try to give them as much information without overdoing it. But the key is really, when somebody comes in, is figuring out what are their issues and what are their goals.
Right.
And making them reasonable, saying, okay, again, we're not, you know, if you got bone on bone, there's not a whole lot we can do for you. As far as we can reduce inflammation, we can reduce pain, but, you know, certain people are going to need other types of medical, whether it's surgery or implants or whatever else is going on. It's like a tooth. If somebody has a bad tooth, you know, they got an infected canal, yeah, we can reduce some of the inflammation and pain, but they're still going to need a root canal or an extraction. You know, so it's most important to have a level that we agree that, hey, this is where I think we can get you to. The key is you've got to commit to it. You know, we've got a lot of people that they want to, you know, they want to come in on their own time. You know, they want to come in once, twice a month. I'm like, that doesn't work that way. If you've got acute issues, a shin splint, we can usually take care of that pretty quick. But you've had something that's lasted, a chronic issue, for 10, 15, 20 years, and you haven't seen any success with everything else that you've done. You come in for 1 or 2 times, you're not going to see success either. So you have to commit to come in 2-3 times a week consistently. And I tell them, you know what? I think by the 3rd, 4th, 5th appointment, you're going to start seeing result. It may not be huge. It may be a shoulder that can go from here to here.
Right.
But for somebody that's had chronic shoulder pain for 20 years, that little bit is huge. So I say, let's do that. Let's do the first 5. I want to see some changes here. And then as we keep on progressing, it starts to go here, here, all the way up to here. And that's what's great. But again, that's the key is when people come in, is you've got to set the expectations, and they've got expectations out of me, and I've got expectations out of them. And if we can agree on that, then we can really see some great success with them.
So tell us some of your other success stories.
Well, certainly my story is pretty good. As you mentioned in the introduction, I had peripheral neuropathy, idiopathic. One of the podiatrists told me, it was the first time I've heard that, idiopathic. He said, well, we call it idiopathic because we can't figure it out because we're idiots.
I like that.
Kind of find out it was more similar to what would be called erythromelalgia, which is a type of neuropathy that causes burning in the extremities, hands, feet, ears. And that, I went from, like I said, I went from running ultra marathons and boxing to not being able to do anything. For a couple months, I had difficulty just leaving the apartment. It was absolutely horrendous. It was horrible. At nighttime, I had to have a fan on my feet. I had to have a spray water bottle to constantly be spraying them to keep them cool. So it was, and it caused me so much anxiety, so much depression as well. So, and I had gone through a couple other types of alternative treatments because nothing else had worked, that had some success but limited. And then I started to treat with the dental laser that I had. And I started to see some success, but again, then I didn't really know what I was doing. I was just putting it on my foot or just putting it on my hand. I didn't realize this is a systemic issue. So when I started my office, first thing I was doing is I was hopping in the bed 2-3 times a week. And, my flares would get really bad and then they would get okay. And then they'd get really bad and get okay. And what I noticed, probably after a good couple months, is that the peak wasn't quite so bad. And the down part lasted longer. And after about 4 months of doing this, a huge, huge change. And you talk to anybody that with chronic type issues, particularly, is dealing with their feet or their knees or their back. That's every waking moment of your life that is in your head, that's affecting what you do. When you have to decide, oh, do I have to go to the city? Well, gosh, I can't be standing on a bus. I can't be standing on a subway. How far do I have to walk? Do I have to get a taxi because I can't walk 3 blocks.
Right.
So when you give somebody, whether it's me or somebody else, and you give them in essence, a new lease on life, God, what a change. And to be able to do it without the side effects that are typical with medications or with surgery or other types of things like that. Just like I said, life-altering for me, and certainly life-altering for many of my clients as well.
I know for me, the one chronic issue I had in my early 30s, I had debilitating arthritis. And at 32, I stood up out of bed and my foot broke. Mm-hmm. I had gotten very, very brittle, very porous, and I got tendonitis in my wrists. And I can remember the emotional impact of feeling guilty, that I was feeling sorry for myself because I couldn't lift a pan off the stove. right? I would drop the pan. And my brain went to, but there's people dying all over the world. There's people in way worse situations. People have cancer. Get over yourself. Pull yourself up by your bootstraps. And the emotional impact of that was to just send me, I just sat on the couch. I just didn't do, and I, of course, ate all the wrong foods and wasn't caring for myself and wasn't, and it took having to heal a horse to start figuring out what I needed to do for me, both with the lights, with the nutrition, with the detox. So my entire program is cleanse, nourish, balance, detox, give proper nutrition, and some of that nutrition is light, and balance. So whether we're balancing the lymph system, the circulatory system, the physical system, the structural balance, but it probably took me a decade after that. After I got out of pain, I started figuring out the nutrition, but it wasn't until well into my 40s that I figured out the forgiveness part and letting go, and learned about lighting up the temporal lobe and letting go of the emotional memory of that pain.
Yeah.
And after that, I mean, I'm 60 now and I don't have chronic pains. Sure, if I go out and, I ride a horse for 6 hours, I'm going to come back in because I'm not doing it enough, and I'm going to come back and be sore. But even at that, I can come in, do my lights immediately, and I'll just know I did it. I'm not going to be crippled up from it.
Right. And to add on to that is the guilt that you feel because you had to rely on other people.
Exactly.
I think that was the worst, is having to, just to rely on family or your significant other, or even have your kids. I mean that's a tough one. That's a tough pill to swallow there when what's occurring to you affects the people around you.
Right. Would you please go get me this? Would you please? Yeah. There's always that. Now you're dependent upon.
Right. And me and you, we are A personalities. We kind of control, we run the roost in a sense, and it's tough to ask for help. Yeah.
It even in all situations, right? It wasn't until I hit well into my 50s that I figured out that if I had business partners, I had other people to rely on, because I didn't want to ask for that help. I didn't want to look like I couldn't do all of it myself. And that comes back. That's one of the beauties about light therapy. If you are that type A personality, or that controlling personality of the life around you, that's not necessarily a bad thing. That's just how you run your life. You can do this for yourself. Mm-hmm. And that to me was that self-empowerment that we offer people. Yes, they may come back and I work with them and help direct what they need to do with their therapy. And I help make sure that everything's on target and set expectations and check in. But then they can go and be doing lights for themselves and their family and their dogs and their cats and their horses, and make this huge shift by themselves. They can do it every morning or as needed, and have those tools without having to instantly give away their power to a doctor, to a therapist, to a pharmacist, right? Yeah, that's a really important piece of the puzzle, that as you start feeling better, you have to feel better emotionally and physically.
Absolutely.
I like the idea of the immersion beds too, because then you get like finishing up your whole process. You start by putting the body into parasympathetic and approaching whatever area is in pain, but then having that time in the immersion bed to let the shift happen, right? And be lighting up. That's going to light up the base of the brain. It's going to light up the temporal lobe. It's going to light up the whole body. Mm-hmm. So you get that emotional release. I like that. Now I want an immersion bed. Not sure where I'm going to put it, but
pretty big.
Yeah. All right. Anything else you want to share with us?
No, I mean, I will tell, and as you know, when I went to your class, I was skeptical. for a lot of people out there, they're skeptical, and I get it. I was skeptical. Even when I understood what light was doing, certain aspects of it, okay, lighting up the meridians, I was skeptical until I had my first session, and we don't need to go into depth on that. But
let's just say you felt it.
I felt it. I felt it. And I'm one of those people where, I've got to see it to believe it. I can't just hear somebody say, oh, it worked for me, and I go, I believe. I've got to actually see it and feel it myself. And with the torches, I felt that. And I was like, wow, that's serious stuff. So for a lot of those people out there that are watching this and it may be brand new to them, is what I say is have an open mind, first of all. 2, do your research. There's over 5,000 studies done on this, dating back 30, 40 years. So just the fact that you haven't heard of it doesn't mean anything. We can go back to cryotherapy 10 years ago, or cupping. Nobody knew about cupping until we saw Michael Phelps swimming. So have an open mind, do your research, talk to people that you trust,
Right.
and try it. And try it and commit to it, and you will see the changes. Absolutely.
Excellent. And don't be surprised if you have to introduce your doctor to it, because it may not have filtered down to them yet either.
And in many cases, and we're, we all have our blinders on to some extent, in whatever aspects of our life. We may be very, focused like this on medicine or on family or on religion or on politics or whatever else. So there's a lot of people and a lot of smart people out there that they've had this tunnel vision of how they were taught in school. And, they may have 20 years of experience, but it may be 1 year of experience and 19 years of repetition. So there's a lot of people out there that, it's their life to treat people in their doctor's office or, writing their prescription out, and that's done just fine for them. So, to look outside of that and a whole different paradigm for a lot of people can be very confusing. It can be very anxiety provoking to say, oh, I've got this other item out there that can work so well, that can replace all these things. And so it's sometimes it's tough to break down the walls of certain people. So that's why, like you said before, it's great for somebody like us to be able to take control over their own health, and be doing things that they know that are good for their body, that they don't have to rely on a doctor visit. They don't have to rely on a prescription pad.
Well, especially right now, I don't want to go anywhere near a hospital.
No,
I don't want to go near where people are very infectious, right? And no matter where you stand on the COVID situation, the beautiful thing is we have a tool that's going to help keep us healthy and prevent me needing to go to a hospital in a lot of cases. Yeah.
And that's why, my, silver lining is more people are looking at light therapy. They're looking at panels. They're looking at something that they can use in their own home. So, even though, my clients are pretty comfortable coming in here, I've had to put in HEPA filters with UV light. I do the temperature check, I do masks, I do hand sanitizer. So we do all the things that we can to make people feel safe. But there's nothing safer than just being able to do this treatment at home if it's possible.
Right. And we've got a couple of sessions where Marcy Denton's going to be talking about the current studies and showing how the light is effective. It's helping to release nitric oxide, and nitric oxide has now been approved by the FDA for fighting coronavirus.
Right.
So,
right.
Yeah. So we're doing more, I really applaud you for doing all that in your offices. Thank goodness I'm not in a situation where I have to do that yet. But also, just by the very nature of they coming in and getting the light therapy, they're going to have so much more nitric oxide loose in their bloodstream they're going to be able to have a stronger immune system in response to any infections, COVID or not.
And just for those people like, hey, we're all going through anxiety. You know, it's tough to
Yeah.
close down your business. It's tough to be unemployed. It's tough to be concerned about loved ones. So just to be able to come in and have a release of that stress and just be able to, for the next few days, just to feel at peace. I mean, just that alone is so huge for people.
Wow. Yeah, I hadn't thought about that part of it. I'm a little divorced from it out here in the rural Badlands of Arizona. So
Well, I'm a rock thrower from Manhattan, so you know we were kind of at you know, where it all blew up really. So this has been, you know, a part of our life since, you know, mid-March.
right, right. You, Seattle and LA.
Yeah.
That's cool. Well, thank you for sharing about your office and your experiences with us. I think it's really valuable for people to hear the different styles and types of light therapy and how they can be interacting with each other, how they can be used together or singly. So I really appreciate your time.
You are very welcome as always.
Thank you so much, dear.
All right. Bye-bye.